So before we dive into this conversation today, we're really delighted to welcome you to the first episode of our webinar series, Meeting the Challenge, Evidence-Based Policies to Support Children's Mental Health and Well-Being. Today, we're going to be discussing income and housing security. For those of you who are new to ChangeLab Solutions, we're a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team works with community organizations, governments, and local institutions to design and implement equitable and practical policy solutions to complex health challenges. Quick disclaimer, some of us speaking today are lawyers, but we're not your lawyers. The information provided today is for informational purposes only and does not constitute legal advice. Our purpose today is to discuss policy options to promote public health. There's no intent to weigh in on specific legislation. We'd also like to acknowledge that this training was made possible in part by a cooperative agreement with the CDC, and the views expressed in this training do not represent the official policies of HHS. As I noted earlier, today is the first of 3 webinars discussing evidence-based policy options to support children's mental health and well-being. Children's mental health is an essential component of their overall health and well-being, affecting how children cope with stress, build relationships, and operate at school and in their broader community. Although mental health and physical health are equally important and deeply interconnected, many families are unable to access timely, effective, and culturally responsive mental health care. Additionally, while rising rates of mental health challenges predate COVID-19, heightened stress, grief, social isolation, and economic insecurity throughout the pandemic have exacerbated these challenges. According to the National Survey of Children's Health, among children from birth to age 17, there were significant increases in children's diagnosed anxiety and depression, decreases in physical activity, and decreases in caregiver mental and emotional well-being and coping with parenting demands. However, the good news is that agencies and institutions have many evidence-based policy options to equitably promote children's mental health, especially for children with disabilities. We're really excited to delve deeper into this topic in this webinar series, supported by the Centers for Disease Control and Prevention. This series brings together researchers, federal partners, national leaders, and ChangeLab Solutions staff to discuss policy options that promote children's mental health. This 3-part webinar series will explore equitable policy options in the following areas: income and housing, workforce and healthcare opportunities, and education. I'll be serving as the moderator today. I'm Maya Hazarika-Watts, Managing Director here at ChangeLab. My work focuses on economic justice and health equity, particularly for children and families. Joining me from ChangeLab, Chastity Coffin will be helping us out on the chat today. You'll see her sharing resources and moderating throughout. Chastity is a senior policy analyst who focuses on policy, systems, and environmental strategies that advance health. My colleagues, Melissa Marichal Zayas and Jessica Breslin, will be joining us as speakers. Jessica is a senior attorney whose work focuses on economic justice, health equity, and healthy communities. Melissa is an attorney whose work supports local governments, public health professionals, and community organizations in addressing the upstream drivers of health through equity-centered law and policy change. Jessica and Melissa both bring direct services experience relevant to our conversation today. We're also thrilled to have 2 wonderful speakers from federal agencies with us today. Leah Lozier is a social science analyst in the Policy Development Division of the Office of Policy Development and Research at the U.S. Department of Housing and Urban Development. She primarily works on issues related to health, disability, and housing opportunity. And we also have Lara Robinson joining us. Lara is a health scientist with the Child Development and Disabilities branch in the National Center on Birth Defects and Developmental Disabilities, Centers for Disease Control and Prevention. As lead of the Applied Research and Evaluation team, she oversees research, programs, and evaluations related to improving health and well-being for individuals with attention deficit, hyperactivity disorder, and Tourette syndrome. I'm going to pass it to Lara now to get us started.
Thank you so much, Maya. So I'm going to talk very briefly this afternoon about policy levers related to income stability and housing to support children's health. My disclaimer states that the findings and conclusions are my own, and as Maya mentioned, they don't necessarily represent the official position of the CDC. Data suggests that nearly 1 in 5 children have a mental, emotional, or behavioral disorder, and approximately 1 in 6 have one or more developmental disabilities. In 2022, CDC colleagues published a report on children's mental health surveillance, in which they used data from 9 different data systems to describe the prevalence of selected conditions in children during 2013 through 2019. They estimated the prevalence of each of these disorders using nationally representative surveillance data. During this period, the most prevalent disorders diagnosed among U.S. children and adults were attention deficit hyperactivity disorder and anxiety, each affecting about 1 in 11 children. To better understand the impacts from the pandemic, CDC conducted a series of analyses examining emergency department visits for mental health concerns among children. Highlights from the results of the first study are shown in the figure on the left of this screen. In this first study, authors found that in 2020 compared to 2019, the proportion of mental health related visits increased 24% for school-aged children aged 5 to 11, and more than 30% among adolescents 12 to 17 years. In the second study, they extended the analysis period through January 2022. Female adolescents aged 12 to 17 accounted for the largest increases in the number and proportion of visits for overall and specific mental health disorders during all periods compared to 2019. The good news is we're starting to see signs of improvement. In a third study looking at emergency department data, specifically on adolescents aged 12 to 17, by the second half of 2022, data show improvements in the trajectory of adolescent mental health. Understanding the roles of policies that may have supported these improvements is a piece of the work we're doing with Change Lab Solutions. So let's talk a little bit about the public health approach to this work. One way to think about public health is to think about the 3 Ps: population-based perspective, preventing poor outcomes before they begin, and promoting the conditions that support health across the lifespan. Said another way, the public health model takes an upstream approach to preventing morbidity and mortality and promoting health for all people. Social determinants of health are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The figure on the slide is the Healthy People 2030 Social Determinants of Health model. These upstream social determinants of health therefore present an opportunity for public health to improve children's health. CDC recognizes the importance of identifying policy levers to address social determinants of health that improve the health of children. This webinar will focus on 2 key social determinants of health: economic stability and neighborhood and built environment. Healthcare and education are the focus of other webinars that Maya mentioned and describe some of our shared work with Change Lab. We funded Change Lab Solutions to analyze current policies and develop tools to increase the use of evidence to inform decision-making about policies to improve the health of children. Improved economic security can support child health by reducing family stressors and adversity by helping parents meet basic needs and even save for emergencies. For example, a 2016 study by Hamad and Rekoff found higher earned income tax credit payments were associated with improved short-term behavioral problem index scores 2 years later. The housing quality, stability, and physical and social environment in which a child lives can all impact health. For example, a 2024 meta-analysis by Dimitrov and colleagues on ADHD risk factors found lead exposure was a risk factor for later childhood ADHD. Lead exposure rates vary substantially across communities, with children from lower socioeconomic groups experiencing the greatest risks. So thank you. I'm going to hand it back to Maya to talk some more about some of the specific policy levers around income stability and housing to address health inequities among children.
Thank you, Lara, for that overview. Before we move into our discussion with our speakers, I'm going to share a little bit more foundational information just to ensure we're all on the same page. So first, what is policy? We use a very broad definition. We consider everything from local ordinances to contracts as policies. The characteristics that these have in common is that they're written down, they establish rules or principles, and they're applied broadly. Not all policies are equal in terms of efficacy or strength. Policy generally refers to a written statement of a public agency or organization's position, decision, or course of action. Law refers specifically to the codification and institutionalization of a policy by a government in the form of an ordinance, statute, or regulation. All laws are policies, but not all policies are laws. Policies can help us achieve a number of goals: initiating widespread change, sustaining that change over the long term, and undoing historical policy-driven harms. Policies also help us focus on structural problems rather than individual behaviors, and that's something we'll be talking about a good bit today. And just right before we get started, I'm going to share this pyramid. So as director of the CDC, Tom Frieden developed this 5-tiered pyramid, which provides a framework for how to address a whole host of public health issues. The health impact pyramid identifies public health interventions across a continuum, from counseling, education, and clinical interventions to those that make individuals' default decisions healthy and address socioeconomic factors. Public health interventions at all levels of the health impact period could include public health policies and laws. And while implementing interventions across all of these tiers is necessary to achieve the greatest possible public health benefit, interventions on the lower tiers have the greatest potential impact because they reach broader segments of society and focus less on an individual's effort. The National Academies of Sciences, Engineering, and Medicine report that, on average, a child growing up in a family whose income is below the poverty line experiences worse outcomes than a child from a wealthier family in virtually every dimension, from physical and mental health to educational attainment and labor market success. Today's webinar will highlight income security and housing policies that can help lower poverty rates and strengthen families' economic stability. Panelists will share strategies that can be taken to strengthen the implementation of policies that support families and connect these policies to children's mental health. We recognize that healthcare interventions are also critically important, and we'll explore those further in our second episode. We hope you'll join us for the entire series. And now I'd like to kick off our conversation by inviting Jessica to share a bit about income security and children's mental health. Jessica, this might sound a little basic, but why is it important for families to have economic security? And how does that stability support children's mental health?
Well, I think building off of what you just said about the NASIP report, the National Academies of Science, Engineering, and Medicine, they produced a report in 2019 called a roadmap to reducing child poverty. And in addition to reviewing the research and literature that shows that children below the poverty line have worse outcomes, it also found that alleviating that poverty can promote children's development because it allows the family to purchase more goods and services that can provide support for the children, but it also promotes a more responsive, less stressful environment in which more positive parent-child interactions can take place. So it can help alleviate some of those structures and environments that can exacerbate poor health outcomes while also providing additional supports to improve the health outcomes for children.
And in terms of programs that help support income security for children and families, can you describe the existing benefits that might be accessed?
Sure. So in a little bit, I'm going to talk more specifically about SSI, which stands for Supplemental Security Income. But Social Security also has a number of other supports that can provide help to families. There's things like survivor's benefits if a parent has a child who has died, which is a cash benefit. There's also SSDI, which would be more for a parent or a caregiver who is also experiencing disabilities and can provide financial support. It's a cash benefit. And generally, these programs can also come in most states will also come with a link to Medicaid, which is a very essential support for children. There's a number of other federal benefits, such as the SNAP program, which might be more commonly known as food stamps, which provides additional support for food security. There is TANF, which is the temporary aid for needy families, which is another cash benefit, and requirements will vary state by state. It is a federal benefit. There's additional childcare subsidies. And then there's also, we wanted to highlight the earned income tax credit since tax season is coming up. The earned income tax credit can be incredibly important for lifting children out of poverty. It can be worth up to over $6,000, depending on the family income, the marital status, and the number of children. And later, at the end of the webinar, we'll be sharing a recently published paper last year by Street Cred, which is part of Boston Medical Center, which looked at the impact of earned income tax credit on families and economic security. I mentioned Medicaid already. Later in the webinar, we'll get into more housing programs. There's those at the federal level, such as Section 8 or a housing choice voucher program. And then there's also certain states will have different homelessness programs or housing assistance programs. And then some local communities also will have programs such as things like utilities assistance, rental assistance, mortgage assistance. And two more things I wanted to point out is there's a various different paid leave programs. So that'll vary a lot depending on the state and city, but those can be incredibly important supports for families, especially paid family leave if you have children with disabilities and they have a lot of appointments that they have to go to and you need to take time off work to protect against lost income or losing your job and things like that. And then there's also regional center supports, which can help children with disabilities. And those can be things like live-in aids or in-home supportive services. And there can also be different cash benefits related to those. There are a lot, but the programs can be pretty complicated with the eligibility requirements, but can be available at federal, state, and local levels.
Whew. Thank you for that comprehensive overview. There's a lot out there. You mentioned SSI, which we're going to focus on a bit because this is a program for children with disabilities. Can you tell us how it supports those families and what are some opportunities to help more eligible children access that benefit?
Sure. So SSI is a cash benefit. It's for children or adults who are experiencing a disability that significantly impacts their functioning levels. And the research has shown that it can lift nearly half of participants out of poverty. And without the program, the child poverty rate would increase by almost 15%. But there's also a significant amount of research that show important connections between poverty and children's mental health, like we've been talking about. But SSI can help lift them out of poverty. Again, there's also often that link to Medicaid, which can be an important help, and it can ease eligibility requirements for other benefit programs. We recently have released a number of fact sheets that talk about the different SSI policies and policy options for supporting families navigate that process at the local, state, and federal level. So, for example, we recently have a series of fact sheets about the appeals process. So it goes over like what that looks like. And then at the end, there's policy options such as at different levels for supporting families, such as providing the families with application and appeal support through partnerships with legal aid or medical legal partnerships or other types of programs that connect families with attorneys and advocates that can help them. Communities may also provide support through training, social workers or benefit navigators and teachers and other individuals who interact with the families and children who need to access these benefits most. So we'll be sharing them later in the webinar, but I encourage you to check out our fact sheets for a deeper dive on the SSI program and the different policy options to support families.
Thank you, Jessica. And I know Chastity is sharing some of those resources in the chat now. If you missed them, they'll be circulated again at the end and also after the webinar. That was a really illuminating overview of some of the income support programs that are available. Now I'm going to invite Leah and Melissa to weigh in on housing. How is housing connected to income security, and why is it such a critical factor in children's mental health?
Thanks, Maya, and hello, everyone. So as Lara, Maya, and Jessica have already laid out, economic security in general is a powerful predictor of children's mental health and development. And when we think about housing in particular, that's true as well. Of course, housing is a big umbrella, and there's a lot of pathways that might impact children's mental health. And three of those that we think about are housing quality, so the physical conditions of a person's home, housing stability, the ability to secure and maintain that housing, and neighborhood environment. So more broadly, the physical and social conditions in which the housing is located. And those pathways are often interconnected with each other and also with other economic security challenges. So a lack of affordable housing opportunities may then force families to dedicate more of their income to rent. And if they are a low income household, that may present challenges in making choices about which expenses they're going to focus on and going to pay, which then, of course, will lead to additional challenges related to utilities and food and healthcare and all of these essential components of family and children's health and wellness. So that to that second part of your question, Maya, the connection between housing and economic security and income security is really tight, and it's important to think about them. There's basically the two sides of the same coin.
Thanks, Melissa. I really appreciate that overview. Leah, we've heard about why it's so important. Can we hear your thoughts on the state of housing needs in the U.S.?
Absolutely. And good afternoon, everybody. So, Melissa talked a little bit about affordable housing and the income security connection. And the most recent report on the State of the Nation's Housing 2023, which is put out by the Joint Center for Housing Studies of Harvard University, showed that rising housing costs coupled with pandemic-era income losses produced the most significant drop in housing affordability we've seen in years. Between 2019 and 2021, the number of cost-burdened renters, which is defined as those spending more than 30% of their income on housing, increased by 1.2 million to a record 21.6 million households. Among these, 11.6 were severely cost-burdened, which means spending more than 50% of their income on rent. And as Melissa mentioned, such high housing costs, many households with lower incomes struggle to pay for other necessities like food, clothes, healthcare, which have also become more expensive as inflation has risen. In 2021, the median renter and homeowner households with incomes under $30,000 had just $380 and $680 per month, respectively, after paying for household to cover other necessities. So this is the lowest residual incomes in 2 decades. And every year HUD publishes a report on the worst case housing needs in the US. Households with worst case housing needs are defined as very low income renters, households with incomes at or below 50% of the area median income. And those who do not receive government housing assistance, who pay more than 1/2 of their income towards rent, live in severely inadequate conditions, or both. And so this is a really important report because it gives a an important snapshot into what's going on for families with the worst case housing needs. Since 2019, worst case housing needs have increased across demographic groups, household types, regions throughout the United States, and the unmet need for decent, safe, and affordable rental housing continues to outpace income growth, and the ability of federal, state, and local governments to supply housing assistance and facilitate affordable housing production. In 2023, the 2023 report finds that in 2021, during the COVID-19 pandemic, 8.53 million households had worst case housing needs. This is an increase from 2011 and is 70% greater than the over 5 million households with worst case housing needs in 2021. And so really what we're seeing here is that affordability is a major problem. To put it another way, in 2021, there were only 57 affordable units, including those with rental assistance, available for every 100 very low income renters, and only 36 affordable units available for every 100 extremely low income renter households. So a major supply problem here. And families with children are the most common household type among very low income renter households. The number of families with children with worst case needs increased by over 350,000 between 2019 and 2021. And housing quality is also a major concern. An estimated 3.3 million homes with children under the age of 6 have one or more lead-based paint hazards. And an analysis by the National Center for Healthy Housing suggests that over 45 million homes in the US have one or more defects contributing to poor housing quality. Just want to take one more minute to talk a little bit about homelessness, which I think is another important consideration here. HUD recently released the 2023 annual home assessment report, point in time count data. The PIT count offers a snapshot of experiences of homelessness, both sheltered and unsheltered, on a single night. In this case, we're talking about in January 2023, so just about a year ago, just over. Just over 653,000 people, or about 20 out of every 10,000 people in the US, experienced homelessness across the US. This is the highest number of people reported as experiencing homelessness on a single night since the PIT count began reporting in 2007. Over 186,000 people were experiencing homelessness as part of a family, which is 29% of the total population of people experiencing homelessness. So taking this all together, we see that there's an urgent need to expand both the supply of affordable housing and availability, as well as the quality. And that's kind of what we're up against when we're talking about this.
Thank you, Leah. Now moving on, I know we've identified a lot of the challenges and barriers. What are some policy areas to consider when we talk about addressing some of those problems? And we'll look at the federal, state, and local levels, and I think we'll start with Leah here.
Right. So I like that we're moving into this because it's a little bit more of a good news situation. We do have some policy levers at the federal level that we should think about. And the first one, of course, is HUD assistance. So HUD provides rental assistance to over 9 million people and about 4.6 million households through its different programs. 3.4 million children and foster children under the age of 18 live in these families. It's a lot of assistance. Now, there are multiple different subsidy programs, but they serve the same basic function, which is providing a monthly subsidy to make housing affordable to primarily extremely low-income households. Generally, the program subsidizes the difference between a reasonable rent and 30% of the tenant's adjusted income. These programs are broadly lumped into two categories. The first is project-based housing, where the subsidy is tied to a physical unit. So this is typically public housing, right? Like physical units in an area that people can rent. And also, I think a little bit less known is multifamily assisted housing, which is privately owned physical units. The other is tenant-based housing, where the subsidy is tied to the household. And this was mentioned earlier. We refer to this as tenant-based voucher programs, often referred to Housing Choice Voucher or Section 8. And so public housing is owned and operated by state and local public housing agencies. And assisted multifamily housing programs are privately owned, but they receive subsidies from the federal government to keep the properties affordable. And vouchers, on the other hand, enable households to lease up in the private market in a variety of like different neighborhoods up to sort of a payment standard. One thing to keep in mind is that, this is not the silver bullet for housing affordability issues, because HUD assistance is not an entitlement program, meaning HUD serves only about 25% of those that are eligible for assistance. So there's a limit to the reach of these programs. And I do want to touch on one more at the federal level, which is not a HUD program, but it's the Low Income Housing Tax Credit Program. It's a Treasury program. Right now, it is the most important resource for creating affordable housing across the U.S. The LIHTC program, as it's often referred to, gives state and local LIHTC allocating agencies the equivalent of approximately $9 billion in annual budget authority to issue tax credits for the acquisition, rehabilitation, or new construction of rental housing targeted at lower income households. Now, LIHTC units are typically not going to have the deep subsidy the way the HUD assistance can. And actually, folks with housing choice vouchers can rent LIHTC units, but this is an incredibly important program when we're thinking about what we can do at the federal level.
Thank you, Leah, for laying out so many of those important federal programs that we have in place. When we're thinking about policies at the state and local level, there's a real wide variety of policy options, and what options are available and in place will vary, of course, across jurisdictions. But generally, we can divide those policy options into a few broad categories. So first, like the federal government programs at HUD that Leah was discussing, states and localities can provide financial assistance that supports either the creation of affordable housing or the preservation of affordable housing. There's, for example, there's state programs that provide permanent rental assistance, like HUD's programs. There's also emergency rental assistance programs on the financial assistance side. And there's also at the local level, a growing number of housing trust funds, which are programs that provide flexible financial assistance to either build more affordable housing or preserve affordable housing. So there's that kind of broad financial assistance category. There's also at the local and state level the opportunity to think about land use regulations and revising land use practices and planning to encourage affordable housing development. So that might look like thinking about single family zoning and other types of residential density restrictions so that more housing can be built and meet that unmet need. And then in terms of thinking about the current housing that we have, there's a lot of different options. One thing to think about is housing code enforcement. So we have an aging housing stock, and as Leah was mentioning, there's a lot of lead hazards in that aging housing stock. So thinking about improving housing standards at the local and state level, as well as practices for enforcing those housing codes and inspecting housing to make sure that it's up to code and it's quality housing. There's also programs that can support tenants at risk of eviction and homeowners at risk of foreclosure to make that a really unlikely event and really avoid that at all costs and provide more housing stability to tenants and homeowners. So that, like I said, that's a very broad spectrum of policy options. And at our website, changelabsolutions.org, we have a number of resources that go into more detail around some of those options. We have a recently published proactive rental inspection guide if you want to learn more about that. There's also, we are currently working on a resource just continues this discussion about housing and children's mental health specifically, and some of the policies that I just mentioned. So that will be published later this year. So you can check out our website for more resources.
Thank you both for that comprehensive overview. And then you touched on this, Melissa, and I'm going to start with you, but what are some strategies to consider, practically speaking, when we are talking about helping families access safe, affordable, and stable housing?
Yeah, so I think that there's several steps that anyone can take in partnership with your organization or with your broader networks. And one of those steps is simply joining or establishing a cross-sector coalition. So you can start that conversation with other local organizations, with government agencies and community members that all care about figuring out how to address these unmet housing needs. Another option is thinking about coordinating and aligning mental health and housing services so that we are, and income support, so that we are supporting community members where they're at, and making the process of accessing services as easy as possible, connecting households who are in need of housing assistance or support, preventing eviction, for example, connecting them up with legal services or the right places to go as early as possible. Another one of those kind of cross-sector options is thinking about establishing medical legal partnerships, which are essentially just putting together our medical and healthcare workers who are supporting households with the legal supports, legal aid offices that are also working in that community. And again, trying to reach people where they are when they're in need of assistance, and also identifying problems early on so they can be addressed before they have long-lasting harm. And again, participation can look really differently, but it's starting from a place of connecting with members of your community and thinking about what your community needs and wants to focus on is a first step. And then for individuals that are coming from a research background or a mental health evidence-based background, in the housing world, there's a need to continue to build the evidence base and understand how our current programs and policies are impacting children's mental health and housing. So that's another really important piece of the puzzle that you can connect with, both in terms of studying and understanding current programs and policies, and also connecting with partners who might be considering beginning a new program, and having that support of evaluating it from the beginning can be a really helpful piece of the puzzle for us to better understand what's needed.
Thanks, Melissa. And Leah, would you like to weigh in on the federal side here?
Yeah, I really feel like Melissa hit on so many of the important key areas, but I want to add that one thing we think about at HUD is housing as a platform, and that it can be leveraged for program and service delivery, particularly in our project-based housing programs, right, like public housing. Partnering with affordable housing providers, which often struggle to find and pay for services, is a great way to bring community resources to those who need it most. So taking advantage of the fact that, at least in HUD programs, folks are receiving a housing subsidy. How can we then bring in the services? And just a couple of examples here. One is the Maternal, Infant, and Early Child Home Visiting Program, which is funded by HRSA, this Health Resources and Service Administration. This program supports pregnant people and parents with young children who live in communities that face greater risk and barriers to achieving positive maternal and child health outcomes. And this program focuses on early childhood development, especially preventing child abuse and neglect, promoting positive parenting, supporting school readiness, and then states can choose evidence-based models that fit their community needs. Another one is HUD's Strong Families program, integrating the Office of Public and Indian Housing's supportive housing services programs. Public and Indian Housing, they run the public housing programs. And the idea here is to deliver quality, impactful resources directly to residents. This program is focused on 3 pillars: health, education, and economic empowerment. And mental health is one of the focus areas of the health pillar. So I think more broadly, organizations can really work with their local housing providers and public housing authorities to help bring resources to residents, even outside of the formal programs that I mentioned.
Thank you so much. I want to thank all of our panelists today for contributing to a really dynamic discussion. And we've reserved a few minutes for questions from the audience. So please feel free to drop those into the chat, or sorry, into the Q&A box if you haven't already done so. And I see a request here. Leah, can you just mention again or put in the chat the program and the agencies that support the early childhood population and their families that you mentioned?
Yes, let me grab those links. I'll put them in the chat.
And then we had a question about promising practices for utilizing Medicaid funds through 1115 waivers to fund services that support access to safe, stable housing. Is that something you can provide a little insight on, Leah? We've shared a Kaiser Foundation report, but wonder if you have any thoughts and any opinions on federal barriers to these partnerships.
Yeah, so I don't want to pretend to be an expert on 1115 waivers. It's a Medicaid demonstration program, but it's really exciting for us because it's really, I think, the first time where there's an opportunity on the healthcare side to pay for short-term housing rental assistance. So one of the components of the 1115 waivers is paying for health-related social needs, which we often also think of like as the social determinants of health, right? And there's a lot of variety, as far as I know, about what states can do with their waivers. But one thing they can do is pay for short-term rental assistance. And hopefully the idea would be to then parlay that into permanent or stable housing for folks that need that kind of stopgap to then get them into something else. But I don't think we don't really know yet what's working and what states are doing and what the barriers are going to be and successes, but it's something that we're keeping an eye on because, I mean, I personally just think it's the most exciting thing in town when thinking about new ways of providing rental assistance and help with rental housing.
Thank you, Leah. And then I'm just going to ask everyone to weigh in, all of our speakers here. We've talked a lot about the importance of community voice, and a lot of different policies and strategies have been mentioned. Can you share one action that communities could take today, and that's all the stakeholders we've been talking about, one action that communities can take to support families with accessing these benefits to improve income security and housing stability and safety? And let's start with Jessica.
Well, I saw in the chat someone asked about benefits navigators, and that is definitely a strategy for helping children and families access these benefits when they're eligible for them. And that's something that we've seen done at either the state level or the local level in pairing families with navigators who can then help them with all the paperwork and different eligibility requirements and making appointments and things like that.
And Jessica, actually, since I have you now, we also have a question about dual enrollment. Can you speak on that? For example, automatic enrollment in some of these programs if you qualify for Medicaid, for example?
Sure. So there are certain programs where you will just be automatically enrolled in other programs once you're found eligible. So like Maya was just saying, if you're found eligible for SSI, in most states, you'll automatically be enrolled in Medicaid as well. And then that can also be a strategy for states at local level is by making eligibility for public state supports, being if you're eligible for Medicaid, you could automatically be eligible for the state support or local support without having to go through additional application processes and show that you meet the same eligibility requirements.
Thank you. And then I'll pass it to Leah. Like to hear if you have any thoughts about benefits navigators and also if there's one action that comes to mind for you in supporting families and children in these areas.
Yeah, thanks. And I appreciate the question about the benefits navigators that I saw in the chat. We have a couple of programs at HUD that we call them different things, whether it's a housing a service coordinator or a benefits navigator or a family coach. And really those are about helping folks in HUD assistance access these resources because it's so difficult. And generally HUD is not paying directly for services. And so it's about kind of figuring out what the family needs, what services are available, and then how to get them connected. And it can be both on making sure that they're getting all the benefits they are eligible for, such as SNAP benefits, food assistance, or Medicaid eligibility, but then also thinking about what else is in the community. And we do this sort of across the lifespan, both for families and then for older adults. But I think that is a key issue of there is a lot of great stuff out there, but the access part is really, really difficult. I think it's difficult for anybody, but some of these programs can be the process for accessing them can be pretty opaque, and it's difficult to even know what's available. And so I think to answer your question about like what actions can people take, I think it really is about there's often such a disconnect between people providing resources and programs and services and the housing folks, and they often don't speak the same language, particularly in the healthcare sector. And so I think working in your communities to help like bridge those gaps. And a big thing is just bringing housing folks to the table, bringing state housing finance agencies, bringing public housing authorities, bringing multifamily assisted property owners in your community, bringing landlords, like bring them to the table when you're thinking about programs and trying to get benefits out to your community.
Thank you, Leah. And Melissa, we received a question through the Q&A about supports for families with children who have severe disabilities who may be facing eviction. Can you share a little information about programs, services, strategies that might be available for those families?
Yeah, definitely. So in general, there's likely in every community, there's going to be some legal aid organization that may be available to provide limited levels of representation to households facing eviction. So that's one resource to look out for. And there's also a wealth of free legal information online that's been collected. I can send a link to that, but that's generally the status quo in many communities is that there's a limited amount of free legal representation that does not meet the need of households that are facing eviction. So most households, realistically, including those with children with disabilities, are facing eviction alone without legal representation to guide them and advise them through that process. And so one policy option is to consider establishing a right for tenants facing eviction to have counsel. So essentially expanding that availability of legal representation to ensure that everyone that is facing eviction has legal representation. So in terms of immediate needs, definitely encourage anyone that is working with a family who might be facing eviction to look into what legal aid organizations might be available in your community. even if they can't take the case, sometimes they're able to provide some advice to sort of give that family a bit of direction. And there might also be information about, emergency rental assistance and other things that might help prevent that eviction from occurring. And then in terms of policy and systems change, thinking about what options are available to increase legal representation, and also to potentially create additional tenant protections that, like I was saying earlier, that might make evictions more rare and a real last resort.
Thank you, Melissa. I know all of our panelists kind of touched on the limited resources and capacity, and I see a really helpful comment in our Q&A. We all are trying to connect clients, individuals, families to resources which are limited, but creating those healthy partnerships, making sure organizations are talking to each other and being aware of what everyone else is doing and how they can work together to effectively help clients is really key. Thank you for that insight. And then we've shared some resources in the chat throughout. I'm highlighting just a few more here. We thank CDC for their support in developing these SSI resources. In addition to those guides, we also have our blueprint for change makers, a guide to proactive rental inspections, which Melissa had mentioned, and the Health and Housing Starter Kit. All of the links will go out to attendees after the webinar as well. And then we again thank our speakers for their really wonderful insights, their time and expertise. If any of our attendees have follow-up questions, please feel free to reach out to us via email. We hope you all enjoyed our conversation about income security, housing, and children's mental health. We appreciate you spending your Valentine's Day with your true love, public health. Please keep an eye out for invitations to the next 2 webinars in our series. Thank you all for joining us, and we hope to see you again soon.